Joining me now for more on the latest in the pandemic is infectious disease specialist and ABC News medical contributor, Dr. Todd Ellerin. Dr. Ellerin, good morning. Hope you had a safe and Merry Christmas. You know, sad that we have to go back to this topic, but given the high travel numbers that we're seeing and Dr. Fauci's warning of a Christmas and New Year's surge, what should we expect in the next few weeks? How worried are you?
Yeah, Merry Christmas, Diane. I hope yours was fun as well and restful. You know, the concern, as we've seen it before, is we surge after holidays, and especially the fact that you have Thanksgiving on the heels of Christmas, on the heels of New Year's. We're just going to see a multiplier effect here, and we are going to see more cases. Now, we have to be careful because, remember, the country is not entirely even. We have a bit of a tapestry here, and so when you hear about cases going down in the Midwest, I mean, that's encouraging, but I want to warn people that around the holidays, sometimes the analytics, you know, people who are used to giving us numbers and data crunching are also on holidays. They should be. So sometimes there are delays, and I wouldn't be surprised if we see spikes even in places where we're seeing decreasing case counts. We have to be really careful.
And a few countries have now reported cases of that new coronavirus strain first found in the UK, including Canada. So given how that and what we're seeing with this strain, how likely do you think it is that it's already here?
I'd be shocked if it weren't here already. I think what's really important is that the United States needs to really ramp up our sequencing of the virus. We're doing far too few analysis of our viruses, so we don't really know if we have the variant here. Yes, we've done some limited testing, haven't seen it yet, but I suspect that if we start doing robust sequencing, we're going to find out that it is here.
And intensive care units are filling up in hospitals across the country. A New York Times analysis earlier this month found that 78% of ICU beds nationwide were occupied. So what impact does this have on hospitals beyond just not having enough space?
Diane, we have a crisis of capacity right now. We have too much virus, too much transmission, too few hospital beds, and especially too few ICU beds. But as you know, it's not just about creating more intensive care unit beds, because we also need the staff to take care of those patients who are in those beds. In the spring, we had regional transmission, so we could borrow people from other parts of the country who had enough courage and compassion to come to us or for us to go to them. This time it's much different as we have widespread transmission. I can tell you in our own intensive care unit, we are really doubling our efforts right now. We have a packed ICU. We have had to develop alternative cares sites in order to care for these patients. This is really scary right now. And remember, it's not just about the COVID-19 patients. This also impacts the non-COVID-19 patients, our heart attacks, our strokes, our patients with cancer, etc. So we really have to dial down the cases so we don't put that much more pressure on our intensive care units.
Well, and you hit on another point that I wanted to ask you about, which is, a lot of people, when they think about this, they think only of their risk of COVID-19. But if the ICU is full, what happens if you get into a car crash?
That's the concern. If your ICU is full, that means you have to find other parts of your hospital that can care for these patients. Finding the beds isn't just the rate-limiting step. It's also making sure you can't just have any person come in. For example, I'm not an intensivist. I see critically ill infectious disease patients, but we need our specialized intensivists to really care for the sickest patients. And remember, the demand right now is exceeding the supply.
And Operation Warp Speed reported that they anticipated vaccinating 20 million people by the end of the year. So far in this country, 10.8 million vaccine doses have been delivered, and only about 2 million have been actually administered. So does that worry you that we're off pace?
It really is worrisome. I mean, as you know, it's not just about the building the vaccines, the manufacturing. We have to find the right cadence between manufacturing, distribution, and acceptance. And that is a major challenge right now. I'm not surprised that we're behind, because in the beginning you expect there to be missteps. I really hope over the ensuing weeks that we're going to see a significant increase in the uptake.
So too, Dr. Todd Ellerin, thank you as always.
Thanks, Diane.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.